Hello, good evening, my students. Today we will talk about female reproductive system. So what is female reproductive system? In fact, the female reproductive system is a set of organs and tissues which have the purpose of making women fertile and capable of sexual reproduction. In simple ways, the female reproductive system is a set of organs and tissues, and they are responsible to make the female fertile and able to reproduce the children's. And this female reproductive system, it has different parts or different components. So it consists of the breast and internal sexual organs, we call them as gonads, and also external sexual organs called genitals. So it's very simple. The female reproductive system is a collection or the set of organs or tissues which making a woman fertile and capable of reproduction. So it consists of different parts. For example, we have breast, internal sexual organs, external sexual organs, and also we call them genitals. So these we will study all these one by one. All of them we will study as one by one. The internal organs include the ovaries, uterus, fallopian tubes, and vagina. And external organ is vulva, and this vulva, it consists of different parts. We are having labia majora, labia minora, clitoris, vaginal openings. So normally in female reproductive system, so what happened, the ovaries, they are producing eggs, or the oocytes, they are producing on monthly basis, and they are released from the ovary and taken up by the fallopian tubes. And inside the fallopian tubes, this fertilization happens if the sperms are available as a result of intercourse. If sperms are available, then the fertilization will happen inside the fallopian tubes. And if there is after the fertilization, this fertilized egg will implant inside the uterus for a certain period of time, and there will be a birth of a child. So if there is no fertilization, then all the linings of the uterus will be removed from the body as a result of menses or menstruation. So this is a normal simple mechanism in case of human reproduction. So we will study all of them with detail. So first we will discuss about the breast. So what is breast? It's an important component of female reproductive system, and as you know, the breast is responsible for the production of milk and to feed the new baby, the newborn baby. It's very important. So normally the breast is composed of fat tissues and the glandular tissues, and they are located on the thoracic wall on the top of pectoral muscles. So this breast is present on pectoral muscle of the body, on the top of pectoral muscles of the body. So just underneath this breast, there is a pectoral muscles which is holding the breast. And normally it's a collection of fat and glandular tissues. So due to the fat, the breast looks like soft. The softness, the soft structure to the breast comes because of the accumulation of fat cells. Okay, so there are different components of the breast. We are having these fatty tissues, then we are having lactiferous ducts, and we are having mammary lobes, and we are having a axillary tail or tail of the spens. So we will study all of them one by one. So these mammary glands, they are very important for the production of milk, and they are helping the baby. Now we will just check these lactiferous ducts. If you see here, these are the mammary lobes, and then from mammary lobes, this duct is originating. So this duct we call lactiferous ducts. they are bringing the milk. In fact, these lobes, they are producing milk, and then it comes through lactiporous ducts to the nipples. And then we are having these mammary lobes, they are responsible for the milk production. Then we are having axillary tails, or the tail of the spans, tail of the spans. So this is in fact the attachment of the breast in armpit area, yani under the muscles. You can see under the shoulder muscles. So this breast is attached until here with the muscles, and then there are fatty tissues in the breast. Now we will study them in little bit more details. So you see here, for example, these mammary glands. So overall, the breast, we call it as a mammary gland. It's a mammary glands, and it's a modified as we are having in our body the sweat glands. They are producing the sweat. Similarly, these mammary glands, they are modified to produce the milk. So simply we can say these breast as a mammary gland. So why mammary gland? Because they are producing milk, so they are mammary gland. So these mammary glands, or the breast, it consists of 15 to 20 mammary lobes. So these are the lobes. Each one, we call this one as a lobe. So each mammary gland, or you can say a breast, consists of 15 to 20 mammary lobes. So what is the mammary, what is the function of these mammary lobes? They are responsible for the for milk production. So these mammary lobes, they are producing milk. And these mammary lobes, they are separated by each other by a suspensory ligament of Cooper. So these are the muscles which are separating each mammary lobe from each other. So they are being separated by suspensory ligament of the Cooper. And then these mammary glands, they are producing milk, and this then they will open into a lactiferous duct. So this milk will be taken through lactiferous duct in the nipple area. So in the nipple area, these lactiferous ducts, they enlarge themselves, and they serve as a storage of the milk. In this area, they are enlarged, their size is increased, and then they can serve as a reservoir of the milk for certain time. And then there is a nipple also. There is a nipple, the outermost area, which is a little bumpy area. This we call nipple. And then there is a skin, and fatty tissues are there. And you can see backside, this breast is holded by pectoralis major muscles. So they are holding the breast. The nipple also, the nipple area is also surrounded by pigmented skin. We call this one areola. So this areola, the pigmented skin around the nipple, is called areola. So you see, if there is a like a breast, it is here little bumpy, we call it this one as a nipple. And then also this area is pigmented, so this pigmented area we call areola. So this areola, it contains several glands. We call these glands as Montgomery glands, or the glands of Montgomery. So these Montgomery glands, they are producing oil, and they give bumpy appearance to the nipple, and they produce oil, and which this oil is very important for the nipples. It protects nipples during breastfeeding to the child. Okay, it's very simple. I will just summarize. So we are having a mammary glands, or we call breast. So this breast is producing a milk. So each mammary gland consists of 15 to 20 mammary lobes. These mammary lobes, they are producing milk. So these mammary lobes, they produce milk, and this milk is carried by lactiferous ducts to the lactiferous sinus. So in fact, this lactiferous sinus is the enlargement of lactiferous ducts, and near the nipple. So this milk is stored here, and then through the nipples, the baby can take the milk. We can suck the milk, in fact. And also you can take the milk out by some of the machines. You can take the milk out from the nipples. And this nipple area is also having some round pigmented skin. We call this one areola, and in this area there are some glands. We call them glands of Montgomery. So these glands of Montgomery, they are producing oil, and this oil protect the areola and the nipple when the child is like breastfeeded. So this area will be protected by oil, so it will get little moist, so there is less chances of any irritation or something. So this is overall structure of the breast we can see. So we can go a little bit more closer. You can see here the pectoral muscles. So these are the pectoral muscles or where this breast is attached. Then we are having a mammary lobe. You can see here there are 15 to 20 mammary lobes, as I mentioned earlier in my lecture. 15 to 20 mammary lobes, and each one is separated by different muscles, and they are producing milk. And then we are having this lactiferous duct. So the milk produced in these mammary glands or mammary lobes is being carried out by lactiferous duct. And then you can see we are having lactiferous sinus. So these ducts, they are getting enlarged near the nipple area, and they serve as a storage of the milk. And this area, this enlarged area, which is the reservoir of the milk, we call this one as lactiferous sinus. And then we are having a nipple. This is the outermost area, like a little bumpy area, we call nipple. And then we are having this skin surface. We are having this skin, and then there are some fatty tissues. You can see these fatty tissues. It will give a nice look to the breast, and also this give the softness to the breast. And also this, the size of the breast varies with different age group of the female. So this is we talk about the structure of the eggs, structure of the breast. So normally what happens, all the milk is produced, the milk produced by these mammary lobes, then it will be taken by lactiferous duct, and then it will be stored in lactiferous sinus, and then through the nipples it will go out of the body. So this is a simple process in case of milk production and feeding. So then we will discuss the most important part of the reproductive system. We have these ovaries, fallopian tubes, and uterus body and vagina, and also clitoris. So as you see here, so this is the uterus. So this uterus is present in the pelvic bone, It's a hollow muscular organs present in the pelvis. Like the pelvis is the cavity between the hip bones. So this uterus is present in the you can say pelvis, the cavity between the hip bones. And then this uterus is responsible to have the fertilized eggs, and it continues until there is birth. Baby will be developed here. But in case if there is no baby coming here, so the linings of the uterus will be shattered, and they will be expelled out of the body in term of menstruation, or in term of menses. So it's very simple. So normally what happens, these ovaries, there are ovaries, they are producing eggs. So these eggs will be taken by fallopian tubes, and inside these fallopian tube, the fertilization will occur if sperms are present. So if sperms are present during intercourse from the vagina, the sperms will go inside the uterus, then they will go to the fallopian tube, and the egg is here. If egg is here and sperms are here, then fertilization will happen. And after a few days of fertilization, this fertilized egg will implant inside the uterus. And once it's implanted inside the uterus, then it will develop into a baby. But in case if there is no sperms available, and and all the linings of the uterus which has been prepared to receive the fertilized eggs will be removed in as a as a menses. So normally, like, what is menses, or what is this bleeding happens? Normally what happens, so when every month the egg is released from the ovary, it will come to the fallopian tube. So when egg is coming to the fallopian tube, the uterus is making herself ready to receive the fertilized egg. But if there is no sperm, this egg will not be fertilized, and as a result, the uterus has to recondition herself. So all the linings will be removed from the uterus in the form of menses, or menstruation at the end of the month. Okay, then as I mentioned earlier, we are having ovaries which are producing eggs. Then these are fallopian tubes which carry the eggs, and once it's released from the ovary, and then this is the uterus, inside fertilized eggs will develop into a baby, and then we are having a cervix. In fact, the cervix is very important in order to protect the developing fetus inside the uterus, because after a certain time, once the fertilized egg is present inside the uterus and developing into a baby, so during that time the cervix will close the entry of any other microorganisms or any other body inside the uterus. So this will be work as this cervix will work as a barrier, and it will not let any other organisms or any microorganisms to enter into the uterus, so that the baby can be safe and develop into a healthy one. And then we are having a vagina, and vagina, it is vaginal canal, we can see here. So this we can use like during intercourse. And then we are having these outer structure, or like glands, clitoris. This clitoris is also like very important, because it's bring love sensation or sexual sensation to the female. And then there is the labia minora is outside, and also this is a part of vulva, and this is external structure of female reproductive system. Okay, let's have a look a little bit more closer. So you see, these are the ovaries. So these are the ovaries which are producing eggs, and these eggs are taken up by the fallopian tubes, and these are the fallopian tubes. So we can see this like a projection, like structure of fallopian tubes. They take the egg, as soon as the egg is released, it will be taken up by these finger-like structures of the fallopian tube. And then we are having a uterus body. So this is the uterus, this is the body of the uterus. Here the fertilized eggs will come. And then we are having a cervix. You can see here, just after the uterus there is a cervix, and then there is a vagina, and also there is like these are until now we discussed the internal part. Then we will move to the external part. For example, these are the external part we call labia minora. This is the outside part of the reproductive system. Then we are having a clitoris. So this is the clitoris, and this is the opening of the vagina. From here, this opening we use during intercourse, and then from here the sperms are going inside to the uh, fallopian tubes. Okay, so now we will also see the surrounding organs. So what are the surrounding organs in female around the female reproductive system? So these internal sexual organs, they are surrounded by many other organs. These, as we discussed, we are having internal sexual organs. They are surrounded by different organs. So you can see the uterus is formed. So this is the uterus. This is the anus. So in fact, the uterus is formed directly in front of the rectum. Directly in front of the rectum. So this is the rectum. So it's present directly in front of the rectum, and behind the bladder. So behind the bladder and in front of the rectum, the uterus is present, and it's a pear-shaped structures, and it has a pear-shaped structure to cover the upper part of the bladder. And then the vagina passes behind the bladder. So this is the vagina, it will pass behind the bladder. So this is the vagina, it is passing behind the bladder and urethra. This is urethra which brings urine, and then it passes through the pelvic floor muscles and ends in the vaginal opening in the perineum, the area between anus and the public bones in front of the anus. So it's very simple. So here we are discussing about the other organs which are surrounding the female reproductive system. So we are having, you see, just in front of the uterus, we are having a rectum, or you can say and in front of rectum there is a uterus, and then this bladder is coming like in front of the vagina, and you can see this ureter and bladder is also present here and just in front of vagina. And then this ureter is open in the area we call perineum. So this area is between the anus and the pubic bone. So this area is between the anus and pubic bone, so it opens here. So this is the area for intercourse, and then this area is for the urine, so urine to come out. And then there this area for the vagina to have intercourse, and this is the anus. So all these things, they are here. And then there is a colon also, there is a small intestine, and this ureter is coming from the kidney, and this is the rectum after the large intestine. So this is all we can see here in terms of female reproductive system. So in summary, I can explain to you the female reproductive system is a set of organs or tissues which can make a female fertile and capable of reproduction. So when we say fertile, it means to produce a baby. The female which is able to produce a baby is called fertile. And also this female reproductive system consists of breast, and we are having a internal sexual organs and external sexual organs. So when we talk about internal sexual organs, we are talking about the fallopian tube, the ovary, the uterus, then we are having cervix and vagina. And when we talk about external organs, we are talking about clitoris, and also we are having some other parts like a vulva. They are outside the body, and all these are very, very important. For example, the breast is producing milk because it has mammary glands, and it comes through lactiferous tubes, and the milk will be sucked by from the nipples, and this is very, very, very important for the developing baby. And then fallopian tubes will carry the egg from the ovaries. The eggs are produced from the ovaries. In fact, the ovaries, they produce eggs and the hormones which are responsible to maintain the pregnancy in case of female. So these ovaries, they will produce eggs. So this egg will be taken by fallopian tube, and if sperm is available, fertilization will happen in fallopian tubes, and this fertilized egg will come into the uterus and it will develop into a baby, and then it will come out from the vagina or birth canal after a certain time period. But if there is no fertilization, then uh, these linings of the uterus will be shattered out of the body in terms of menses or in menstruation at the end of the month. So this is we are talking about, and I hope you understand that. If there is any question, anything, you can ask me. It's very, very simple. I try to make it simple, and hope you understand. So please follow my channel, and if anything you want to discuss, you want to ask, so please feel free to ask. Thank you so much, and I hope you will enjoy. And uh, if there is anything, please get back to me. Thank you so much.